Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also ESIC, DSSSB, AIIMS NORCET exam, also Kerala PSC DME exam, Insurance Medical Service exam and JPHN exam. We can see the question. First question, identify the incorrect option regarding Venturi mask. Options: option A blue color 24%, option B white 28%, option C green 60% and option D yellow 28%. Venturi mask delivers oxygen concentration from 24 to 60%. Different colors of Venturi mask delivers different concentration of oxygen. Here question is incorrect statement. And the correct answer is option D, yellow color 28%. Here we can see different colors of Venturi mask and oxygen concentration. First one, blue color Venturi mask delivers 24% of oxygen concentration. White color Venturi mask delivers 28%. Yellow color delivers 35% and orange color delivers 31%. Red color Venturi mask delivers 40% of oxygen concentration and green color delivers 60%. Here are question, which is the incorrect statement or incorrect option. Option yellow color is 28%. Yellow color delivers 35% of oxygen. And the next question, a respiratory drive in COPD patient is options. Option A oxygen, option B carbon dioxide, option C pH of blood, option D all of this. A respiratory drive means the hypoxic stimuli which develop in COPD patient. In that case, there will be decreased oxygen concentration in patient body. Once the patient oxygen concentration in the body will decrease, automatically a respiration will increase. That is, respiratory drive in COPD patient is due to oxygen, decrease oxygen content. So it is related to oxygen. Option A is the correct answer. So there we have to give oxygen administration to the patient. And the next question, blue bloater is also known as options. Option A COPD, option B ARDS, option C chronic obstructive bronchitis, option D emphysema. And the correct answer will come option C chronic obstructive bronchitis. Blue bloater is also known as chronic obstructive bronchitis. Here the patient may develop severe breathing difficulty and also decrease oxygen content in the body, which may lead to cyanosis. Okay. Due to this cyanosis, this bronchitis, chronic obstructive bronchitis is also known as blue bloater. And the next question, a new mother expressed concern to a nurse regarding sudden infant death syndrome. She asked the nurse how to position her new infant for sleep. The nurse appropriately tell the mother that the infant should be placed on. Here in our question, a mother expressed concern regarding sudden infant death syndrome. So what is sudden infant death syndrome? It refers to an unexpected death of an healthy infant younger than 1 year of age. And the exact cause for this sudden infant death syndrome is unknown, and it is most commonly occurs during winter months and also during the time of sleep. It means not at night, in all time, daytime or at night time. It mostly occurs during the time of sleep. And this sudden infant death syndrome is most commonly seen in infant between 2 to 3 months of age. In our question, the mother asked to the nurse that which position I can provide to my baby to prevent this sudden infant death syndrome. And the correct answer is back rather than on the stomach. That means the nurse should encourage the mother to keep the baby on supine position while sleeping. First option, side or prone position. We should not provide prone position to the baby. It may cause suffocation. Okay, so we have to give prone position, that is back rather than on the stomach to the baby. And the next question, a client is to begin a 6-month course of therapy with isoniazid. Nurse plan to teach the client to Options. Option A, use alcohol in small amount only. Option B, report yellow eyes or skin immediately. Option C, avoid vitamin supplements during therapy. Option D, all of this. Here our question is, a client started 6-month course of isoniazid therapy. So here, what education does the nurse can give to this patient? Isoniazid is a first-line bactericidal medication for tuberculosis. The main side effect of this isoniazid therapy include hypersensitivity reaction, peripheral neuritis, neurotoxicity, hepatotoxicity, especially increased liver function test level, and also vitamin B6 deficiency may develop for this patient. Then vision changes, hepatitis, all will occur to the patient, those who are taking isoniazid. So as a nurse, she should tell that report the yellowish eyes or skin immediately. Option B is the correct answer. The first option, use alcohol in small amount only. That alcohol should not used by the patient. So the nurse should tell the patient that he should not use alcohol, and also avoid vitamin supplement during therapy. Peripheral neuritis is one of the side effect for this isoniazid therapy. So to prevent that peripheral neuritis, patient should take increased intake of pyridoxine, that is vitamin B6. That also the nurse should explain to the patient. And the next question, washed RBCs blood used for the client with history of. Options. Option A, allergic or transfusion reaction. Option B, hemophilia. Option C, thalassemia. Option D, sickle cell anemia. Washed RBC means plasma, platelets and WBCs are removed and replaced with saline or another type of preservatives. It is mainly used in case of patient with any allergic or transfusion reaction. Okay, option A is the correct answer. And the next question, a nurse just enters a client room and finds a client lying on the floor. Which action does the nurse perform first? Options. Option A, ask the client what happened. Option B, call for help. Option C, check the responsiveness of the client or assess for level of conscious if unconscious. Option D, assist to the client back to bed. Question is, a nurse just enters the patient room and she found that the patient is lying on the floor. So as a nurse, what is the first action she will perform? That is the question. The first thing, the nurse should find out the level of consciousness of the patient. For that, she can shake the patient, or she can talk to the patient loudly, or she can shout like, are you okay? Like that, she can ask to the patient. If the client is unresponsive, then she can call for help. That is the second thing. The first thing, check the responsiveness of the client or assess for level of conscious if unconscious. And the third thing, she should follow ABC, that is airway, breathing and circulation. So the first thing, she should check the level of consciousness of the patient. Option C is the correct answer. And the next question, tracheostomy is usually performed between the tracheal ring of. Option A, second and third. Option B, third and fourth. Option C, fourth and fifth. Option D, all of this. And the correct answer is option A, between second and third tracheal ring. Tracheostomy means an artificial opening made in the trachea and is inserted to establish and maintain patent airway. And the next question, nursing action while doing tracheostomy suction includes. Options. Option A, pre-oxygenate the client. Option B, strict aseptic techniques while doing the suctioning. Option C, assess patient oxygen saturation before, during and after the suctioning. Option D, all of this. And the correct answer is option D, all of this. Nursing action while doing tracheostomy suction include pre-oxygenate the client, and also we have to maintain strict aseptic technique and check the oxygen saturation before, during and after the procedure. Some other points we can see, patient should not be leave alone first 24 to 48 hours after tracheostomy. And also the secretion that are collected in the tracheobronchial tree should be removed by suction, and provide suctioning every 30 minutes on the first day if it is necessary. That is, more secretions is there means we can provide suction every 30 minutes on the first day. And the next question, when suctioning the tracheostomy tube, we must limit the suctioning to a maximum of option A 5 second, option B 10 second, option C 15 second, option D 20 second. The suctioning time should not be exceed more than 10 second. Option B is the correct answer. And the next question, stimulation of vagus nerve result in options option A increase in heart rate, option B decrease in heart rate, option C dilatation of bronchioles, option D dilatation of coronary artery. And the correct answer is option B decrease in heart rate. Stimulation of vagus nerve. Vagus nerve is the 10th cranial nerve. It may result in decrease in heart rate. And the next question, normal CVP means central venous pressure is option A 5 to 10 centimeter water, option B 10 to 15 centimeter water, option C 15 to 20 centimeter water, option D 20 to 25 centimeter water. And the correct answer is, it is option A 5 to 10 centimeter water, normal central venous pressure. And the next question, in DPT vaccine, P stands for options. Option A diphtheria, option B polio, option C pertussis, option D pneumonia. In DPT vaccine, P stands for pertussis. Option C is the correct answer. Diphtheria, pertussis and tetanus. Option C is the correct answer. So far we discussed previous year questions, also important questions for exam preparation. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. Thank you for watching.